Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. I believe healing often begins with connection, and that's really what this podcast is about. These are real conversations about health, healing, life, and the stories that shape us. Some guests come from the wellness world, some come from the community, and some simply bring a life experience worth sharing. My hope is that each conversation invites you to listen, learn, reflect, and maybe see your own life or healing in a new way. Sit back, grab a cup of coffee, and enjoy this conversation with a chiropractor. Today on Conversations with a Chiropractor, I'm joined by Dr. Kevin Smith. Doc is a functional medicine practitioner and founder of the Chronic Conditions Center in Pittsburgh, Pennsylvania. He specializes in helping people understand and fix the root causes of chronic health problems, including gut issues, autoimmunity, chronic pain, thyroid dysfunction, adrenal fatigue, peripheral neuropathy, insulin resistance, and inflammation, just to name a few, using natural and non-invasive methods. After years of seeing patients struggle with symptoms that conventional medicine only managed rather than resolved, Dr. Smith dedicated his career to a deeper approach, restoring balance to the gut, nervous system, and metabolic pathways so the body can actually heal itself. Dr. Smith, thank you so much for being a guest.
Thank you for having me. It's a pleasure to be here today.
So you have so much experience, but what I thought would be really wonderful to focus on today is thyroid health, because I know it's like really truly an epidemic, and I know so many people are frustrated. They might have the symptoms of hypothyroidism, which for our listeners, why don't we list those off?
Sure, no problem. So first of all, hypothyroidism means low thyroid function or low thyroid output. Hypo meaning low, and then thyroid. So some of the symptoms include fatigue or low energy. It also includes your hair falling out in clumps in the sink or cracked or weak nail beds, either in your hands or in your toes. It could include bowel transit time problems resulting in diarrhea or constipation. Infertility, which is very frustrating for women that want to start a family but can't conceive because of some kind of a metabolic issue from the thyroid. It can include problems falling asleep or staying asleep. And if you don't get enough sleep, boy, can that wreck your day the next day.
Absolutely.
Yeah.
Yeah.
And it could cause problems with your skin, resulting in either oily or dry, flaky skin. And it can cause things like brain fog, irritability, nervousness, depression, anxiety, all kinds of psychological problems. And people that have low thyroid disease or hypothyroidism are in their own private hell, and it just never ends. And only about 17% of people that are taking medicine ever get some kind of satisfactory result from that. That means that 83% of people taking Synthroid or levothyroxine or other such drugs never get results that they want.
So what do you tell someone who has all of these symptoms and they say, I went to my primary care doctor and they drew labs and they said that everything was normal?
Well, a part of that is unlearning stuff that they've been indoctrinated to believe for a long time. They think that if they just take the magical pill or the magical bean, that it will resolve everything. And as a chiropractor, I'm sure you realize that it's not going to happen. Medicine has a time and a place. Surgery has a time and a place. Chiropractic has a time and a place. Everything. But if you've already been to the PCP, you've already been to the endocrinologist or whatever, and you've already tried the medications and you're still not happy with where you're at, maybe now it's time to try something different.
Mhm. And I have so many patients who might have quote unquote normal labs, but I think it's really important to say, well, what specific tests were ordered, right? Because the thyroid lab network is it's more than just the two things like TSH and T3 or T4, right? There's the thyroid immunoglobulin antibodies and like, talk a little bit about the autoimmune sort of portion of hypothyroidism.
Sure. In the United States, the number one cause of hypothyroidism is a disease called Hashimoto's disease.
Hmm.
Hashimoto's is an autoimmune condition. And what that means is that your white blood cells, that's part of your defense system in your body, they start to mistakenly attack and destroy your thyroid gland.
Mm.
So, 90% of every case of hypothyroidism in the United States is related to Hashimoto's disease. That's the number one
Mm.
cause in this country. The number one cause outside of the United States is iodine deficiency. We
Hmm.
don't have that problem because we put salt on everything and it's iodized
Yes.
salt, right? So I look for Hashimoto's disease, and it can be picked up very, very quickly and very easily on some blood tests. They're very inexpensive blood tests. One of them is called a thyroid peroxidase enzyme, and the other
Mm.
one is antithyroid globulin enzymes. And if one or both of them is off track, that is a positive sign for Hashimoto's disease. One
Hmm.
thing that I want your listeners to understand is that this is not a endocrine problem.
Hmm.
It's an immune system problem. So it has nothing to do with endocrinology or hormones. It has to do with the function, the abnormal function rather, of the body's immune system.
Now, that statement alone might disrupt our listeners' thinking, right? Because
Yeah.
we've been told that our thyroid is an endocrine system problem. So now you're telling us that it is an immune system problem.
Well,
What?
it's an endocrine organ.
Yes.
It helps you to it helps to produce T3 and T4 or thyroid hormones. However, if the immune system is attacking and destroying the gland, that's an
Mm,
immune system problem.
okay.
So you can have multiple problems at the same exact time. Or as I jokingly tell people, people have the right reserve the right to have more than one problem. Right. So they yeah.
Absolutely. So, someone who's been on Synthroid for 10 years, 15 years, and feels like they still are having issues,
Mhm.
you have some answers for them. You have some resources for them?
Yeah. Yeah. So the thyroid pathway actually starts in the brain. So you have to have enough raw materials to start the process. In other words, you
Mm,
have to have enough oxygen and glucose in the brain, and you have to have enough serotonin and dopamine to steer the ship to make it work. And
hmm,
the first part of that is happens in the hypothalamus and then makes a hormone called TRH or thyrotropin releasing hormone. Then
hmm,
that hormone acts on the pituitary gland, another structure in the brain, to make TSH, thyroid stimulating hormone. In turn, TSH goes into the circulation and directs the thyroid gland, a small butterfly shaped endocrine gland in your neck, to make T3 and T4. Then the liver is involved, the gut is involved, and a couple of carrier proteins are involved. All of
mm,
that machinery has to work correctly for your body to make a sufficient amount of thyroid hormone and to transport it correctly to all the parts of your body to make your cells do their job. And any kind of a breakdown anywhere can result in hypothyroidism. The problem that the medical doctors have is that they only look at one small part of the complex machinery. They look at
Mm,
the TSH T4 loop, and that's it. They don't look at anything else. And so
hmm.
they're going to be missing a whole lot of potential areas that it can cause problems.
So you're truly looking at the entire body and where the systems are broken down, with
Mhm.
the thyroid sort of being the, I don't want to say scapegoat, but like the end organ that is malfunctioning.
Yeah, so I want to point out that the thyroid's the purpose of thyroid hormone is to provide energy for the
Mm,
cells to be able to do their job. Thyroid hormone's job is to regulate your body's metabolism and its energy use while it's at rest.
hmm,
And so the thyroid kind of functions like the gas pedal in the car.
mm.
If you step on the accelerator pedal, the car's going to speed up and it's going to go along. If you take your foot off the gas, the car is going to come to a complete stop or it's going to slow down.
That's a great
Ev-
analogy.
So,
Super great analogy.
so every single cell in your body, all 70 trillion cells, has a receptor site for thyroid hormone on the cell wall.
Hmm,
So every single cell has the potential of having some kind of a hypothyroid issue. So
hmm.
if it's like, say, the neurons in your brain, if they're not getting enough thyroid hormone, what kind of symptoms would you expect for that person to have if they're not getting enough thyroid hormone?
Oh, brain fog, word finding difficulties,
Yep,
forgetfulness.
exactly. Dep
Yeah.
Exactly. So brain fog, probably the number one symptom, or forgetfulness, cognition issues,
Mm,
depression, anxiety, nervousness, irritability.
mhm.
Things are just not working right. If it's
Hmm.
gut if it's the gut, what kind of symptoms would you expect to see?
Well, I would expect to see perhaps that they are having constipation or trouble digesting their food, or
Ye
perhaps
Bingo.
fluctuations between diarrhea and constipation.
Yeah, yeah, exactly. So the gut, if it's the heart, they could expect the heart to flutter, or
Mm,
maybe a condition called bradycardia, which means that it slows down the beats, or if tachycardia, it speeds up, or fluctuations between both. So every single cell in your body has to have the correct amount of thyroid hormone to be able to do its job. So, in that respect, the thyroid can be thought of as a master regulator of the entire body.
hmm,
Now, beyond Hashimoto's disease, I also look for what are called triggers. These
hmm,
are things that can disrupt thyroid physiology in a significant way. These are things like anemia.
hmm.
That's a problem transporting blood on the red blood cells. Blood sugar problems like insulin resistance, type 2 diabetes, prediabetes, things like that. It could involve cortisol, which is your stress hormone that regulates your autonomic nervous system, regulates your fight or flight response. It can be caused from sex hormone problems, such
Hmm.
as estrogen, progesterone, testosterone. Remember, boys and girls make both, and they
Mhm.
have to be in the right amount for their gender and for your age. So, a 58-year-old man is going to have a significantly different profile than a 23-year-old woman. Uh,
Absolutely.
it can involve chronic inflammation, oxidative stress, gastrointestinal problems, food sensitivities, chemical sensitivities, and unresolved viral infections like Epstein-Barr virus or cytomegalovirus or herpes. Those things can all of them can have a disruptive effect on the physiology, and your medical doctor is not looking at all those potential sites for
Mhm.
where the breakdown is occurring. And that's one of the reasons why so many people have unresolved thyroid function problems.
Because it could be any one of those triggers. It could be any one of those things that sort of pushed them into that state.
Correct. Yes.
Hmm.
Yeah.
Do you see much more hypothyroidism than hyperthyroidism?
Yeah, probably about 97% of all the cases are hypothyroidism.
Hmm.
And if they have a immune system issue, not involving necessarily Hashimoto's, but any kind of immune system issue, that can cause a condition called Graves' disease. And that's
Mm.
called hyperthyroidism. And you've seen people that have Graves' disease, or maybe you haven't, but those are people that have bulging eyeballs. That's called
Mhm.
exophthalmosis. The actor Marty Feldman in the '70s had that. The
Hmm.
baseball player Ryan Braun has this, and it's a problem. But probably 97% of all cases involving the thyroid involves low thyroid function, not high thyroid function.
Mm. So, when we first started talking about the thyroid, you said this is really like an autoimmune type disease. And you talked about some of those triggers. So, when someone comes into your office, are you looking at like everything in their environment, what they're eating, what their lifestyle is, what their social situation is?
Yeah, I look at all that stuff and consider everything. The first thing I do is I start off people by having them complete some intake forms and some questionnaires. I want to look at their drug list. I want to look
Mm.
at allergies, their lifestyle, their diet. I have them start by completing a couple of quick questionnaires. One of them being a metabolic questionnaire, the other one being a neurotransmitter questionnaire to look at the
Mm.
central nervous system and see how they're doing with that. After that, and I want to start off by doing some foundational lab tests. And
Mm.
by foundational lab tests, they're much more comprehensive than what you get at a primary care physician's office. My I would estimate that on average, the average person goes to the PCP and gets about 10 to 15 metabolite markers on their test. Mine involves 63
Wow.
plus a complete
Wow.
urinalysis. So, for
Mm.
example, when the medical doctors uh, do a test for the thyroid, they do a TSH, or thyroid stimulating hormone, and maybe a free T3.
Mm.
I ordered 9 or 10 different tests. So I want to see the entire metabolic pathway and where a potential breakdown is and what's going on. So we look at inflammatory markers. We look at the function of the liver and kidneys, blood fats like triglycerides and cholesterols.
Mm.
We look at the body's iron cycles to see if there's a potential of an anemia that can cause metabolic disruption. We look at vitamin D levels. We look at uh, a CBC, a complete blood count with a differential, plus a urinalysis to see how they're filtering their blood. Just literally everything. And
That's amazing.
from there, I can get some real clean information. What's really important, though, is that it's objective
Mhm.
information. So I base my decisions on objective data points. That's
Mhm.
how I determine what the person needs. So one person may have a severe vitamin D deficiency. Another person may have an anemia. Another person may have problems with chronic inflammation. And from there, I can determine the severity of the problem and where it's coming from and what to do about it. And
Mhm.
so I treat people like an individual, like they should be. It's not one size fits all. So when people call me and they say, "Well, how much is this?" I have no idea. It's like calling the grocery store and saying, "How much are groceries?" I have no idea if you're going to eat salmon and scallops and steak, or you're going to eat casseroles all week. I don't know.
Yes. Absolutely. We might as well talk about this while we're at it. I feel like Western medicine has become very insurance based, and we think that if something isn't covered by our insurance, then then it's unnecessary or it's excessive if we go to a physician who doesn't quote unquote take our insurance. What would you say about that like specific thought pattern that tends to be so prevalent in the United States?
Boy, you talk about a can of worms right there. Holy cow. All right. So, by the time a guy walks into the primary care physician's office, their treatment plan has already been predetermined for them
Um,
usually by an actuary that works for the insurance company that sits in a cubicle in a different city. He's never met you. He's never looked at your labs. He's never done a physical exam. He's never looked at your x-rays or any kind of other imaging or
uh,
knows absolutely nothing, but he is making critical decisions as far as
mhm.
your overall health for you.
Yeah.
This is very frustrating for the physician. It's very because their hands are tied behind their back. They go to
Mhm.
school all this time to learn all this stuff, and they can't even make decisions. And
Yeah.
the one thing that I want your listeners to understand is that the insurance companies don't care about you. They don't care about your health. All they're doing is just enough stuff so they don't get sued and
Mhm.
nothing more. So the doctor is going to know exactly what insurance companies you have. He's going to order just enough tests to arrive at a diagnosis in order to justify prescribing a drug. He's not going to do this to find out what's wrong with you.
Mhm.
Medical doctors don't cure anything except for one disease that would be like a bacterial infection that could be cleared out by antibiotics. But they
Mhm.
don't cure anything else. They just manage it. Like all
Yeah.
these chronic illnesses like diabetes or high blood pressure, low thyroid problems that we discussed before, they don't cure that stuff. And if you
Mhm.
wanna challenge it, stop taking your medications for, like, a week and see what happens,
Yeah.
you know?
Yeah.
I'm not anti-drug, I'm not an anti-doctor. I
Mhm.
believe, again, that there's a time and a place for all healing, but I want your listeners to understand that they're not getting their problems corrected. They're just managing the problems, usually in the form of a drug that's gonna suppress symptoms, and that's it. And
Yeah.
that's not what I wanna do. I don't wanna just chase after symptoms. I wanna find the hidden root cause of what's driving the problem in the first place, so I can put an end to all this misery.
That's wonderful. And I'm sure that you have a lot of people who perhaps you're their last resort. Maybe they've gone to many doctors, they've been on many pharmaceuticals, and they just don't feel like they're making any headway. Would you say that you see a lot of people who say, "Doc, you're my last resort. You're my last hope."
That's usually what happens. Usually people go to they well, we live in a drug culture. So
Mhm.
the first thing that happens is that they reach for the medicine cabinet and try some over-the-counter drug or something that they pick up at the local pharmacy. And then when that doesn't fix the problem, then they go to the primary care doctor for something stronger. And the primary care physician typically works with about 12 drugs. And if they can fix them, fine. If they need to refer them out to their buddy down the street that plays golf with them on Thursday, they'll send them to that guy. And
Mhm.
he works with another 12 drugs and so on
Yeah.
and so forth. And it's very, very common for people to be taking a lot of drugs. On average, when somebody comes in my office, they're on about 7 different drugs.
Wow.
And so the most I've ever seen in my career, a guy came in my office with his drug list. It was a page and a half, single space typed.
Wow.
He was taking all these drugs, and he walked in like a zombie because he could barely keep his head upright
Of
from being
course.
on medications from the doctors that clearly don't talk to each other.
Well, that's the trouble is all of these pharmaceutical interactions and maybe even like misinformation, like, oh, you should take this on an empty stomach, but this should be taken like 2 hours after a meal. I think that if you're on so many medications, I mean, definitively they're interacting with each other and how are you even, my gosh, like getting them all down your throat? It's crazy.
So
Crazy.
I'm my base degree is I'm a chiropractor too, but it's not. I'm in Pennsylvania. I'm not allowed to tell people not to take their drugs.
Mm,
But what I do instead is I educate people about the potential side effects of the
mhm,
medications that they are taking. So I have a PDR, a physician's desk reference, and I make a photocopy of the page that shows all the different potential side effects. And I can highlight certain things, like if the person is taking a medication and one of those side effects happens to be constipation, and they're complaining about being constipated all the time. I can highlight that and I can say, go have this checked out. Walk into a CVS or a
mhm.
Walgreens and talk to the pharmacist and hear what they have to say. I find that the pharmacists are usually really good sources of information and they don't have a dog in that fight. They're not a paid consultant, and they'll tell people the truth about all the side effects and what this stuff does, and I think that people deserve to be more informed.
Absolutely. And I think that, like a lot of people, and I don't mean this in the wrong way, but they're not health minded and or medically minded. So, how many decades ago, whatever a physician said with a white coat was the word of God. And that is what you followed and you didn't ask questions and you didn't think twice. You just did what they said because they knew everything. And that sort of like white coat mentality, I think is very Western, very, very much in our Western mind.
Yeah, and that now has been replaced by people second guessing everything I say with Doctor Google. So yeah,
Oh, yes, Dr. Google. Everyone's favorite doctor.
exactly.
Yes, yes. So you start with all of this wonderful lab work, and I'm sure that you maybe look at their diet. Do you look at food allergies? Do you look at sensitivities?
Well, first of all, there's no one test that's going to be able to give you 100% of all questions, give you 100% of all answers to every question out there. That's why we have different types of lab panels. So, one test that I can do is exclusively a food allergy panel. And usually that involves uh, drawing some blood from your finger and then sending it to a lab where they can compare your blood to 95 different known usual suspects
Hmm.
and find out how reactive that your body could be to those types of foods. And I did this to myself one day and I found that I had a problem with crab, and that made me very sad because I love crab meat. I
Oh.
don't I don't stop eating crab when I'm full. I stop eating crab when I'm tired. So, but I it doesn't love me back. So I had
Oh.
to knock that out. But, using these indicators, it helps you to find answers very quickly and
Mhm,
find out what you have a problem digesting and absorbing into your body, whether it's dairy, whether it's grains, whether it's certain foods like eggs or beef or whatever. It's much faster than the old-fashioned way, which is to do a an elimination diet
mhm,
where you just basically eat nothing and then you slowly introduce foods and see if it bothers you.
mhm.
This you can get the answers really quickly.
Nice, nice. Can you talk a little bit, maybe this is too deep for our listeners, but can you talk about the difference between like a blood test for an allergy to food and like a skin prick test for an allergy? Like IgG versus IgA versus IgE. Can you talk about that a little bit?
Sure. So, when you're dealing with the immune system has a component in it called the complement system. And the complement system has different factors depending on what body part or what you're evaluating for. Collectively, those complements spells gamed,
Hmm.
GAMED. So there's IgG, IgA, IgM, IgE, IgD. So different parts of the body are more or less sensitive to different parts. And in the gut, I evaluate an IgG. That
Okay.
is a different type of a factor in the immune system than, say, a medical allergist that is looking for a anaphylactic reaction or an instantaneous reaction that they suspect is going on. So if they suspect that a kid has a peanut allergy, they're going to do an IgE test. And the IgG test is very sensitive, and it's I tell people it's like a firecracker with a really long fuse, because you could eat something on Monday and not have a
Mhm.
symptom until Thursday, and you're wondering, like, what did I do? What's going on here? I don't understand this, with this delayed reaction.
Mhm.
But that is what you actually need to find out what kind of foods could be causing a trigger or a problem in your body.
I think so many people think that they're going to have that immediate allergic reaction. Like, well, if I was allergic to dairy, well, then, I would have nausea or diarrhea but I like that analogy that you used of like the firecracker with like a long, long fuse, because
Yeah.
it sort of is like the straw that breaks the camel's back, right? Like our system can tolerate things and tolerate things, and then like it just wears down and wears down until it's going to have a reaction, which maybe not even be the reaction that we would assume, right? Like perhaps someone who has frequent sinus infections or some sort of other like overgrowth of yeast, they might have a food allergy that doesn't seem like very easily cause and effect, right?
Well, I find that some of these tests, there's some overlap.
Mm.
That, like, for example, um, I have a problem with milk products.
Mm.
I have lactose intolerance. And so when my kids were younger and I would take them out for some ice cream or something, and I would have a little cone with them to be sociable and do a dad thing, it would make me sick as a dog by the time I
Mm.
got home. And
Huh.
later on, I learned that it was due to a lactose intolerance problem, where my body has a problem breaking down the milk sugars that go into like ice cream or milk, and it causes a adverse effect on my physiology.
Hmm.
A lot of people have these problems. A lot of people, we find a lot of people have problems with, say, egg whites or
Mm.
certain grains or things like that. Um, but I run this test quite frequently because I want to get some objective data points so that it's not guesswork. When I'm making my recommendations, it's based on ironclad data, not just on just guessing. See
Mhm.
what's going on. But the IgG4 test that I'll do is based on it's called a blood spot test. So it gets some blood out of your finger, and then they run that test against 95 different known antigens
Mm.
that are out there. And some of them, they can even do a test for like 164 and
Wow.
look at spices and all kinds of stuff. If the person's really, really sick and everything is setting them off, no matter what's going on, I suspect an immune system issue. So, like, celiac disease is an autoimmune disease involving the villi, which are small finger-like projections in the small intestine, and they get really blunted and really small, and they suffer from a problem with absorbing nutrients. So even though they're eating lots and lots of calories, they're still nutrient deprived because they can't
Mm,
absorb it into your system. And that can really be thrown off by consuming gluten and other types of foods that cause problems. Other autoimmune issues involves the large intestine. The purpose of the large intestine is to reabsorb water, and so some of these problems involved are called Crohn's disease or ulcerative colitis, and ultimately it boils down to immune system issues. In
mhm.
my office, you're autoimmune until proven innocent.
Okay. So, Doc, let me ask you, once you do all these tests, what kind of treatments do you give your patients? I would assume if they do have food allergies that there will be diet modifications. You
Yes.
talked a little bit about looking at the meds they're currently taking. We know, through each other's profession that we do not prescribe a pharmaceutical. So what kinds of treatments are you giving your patients?
It's a combination of lifestyle modification involving dietary changes, improving how much they're going outside and exercising and getting sunshine, uh, using supplements to do just that, to supplement a healthy diet. So, I mean, you can't go to McDonald's 6 days a week and then take a multivitamin. That's silly.
Yeah,
But
right.
if you're following an autoimmune paleo diet or a ketogenic diet or something focusing on lean meats, fruits, and vegetables, and then you take fish oils to decrease inflammation, or you take a probiotic to work on the body's microbiome, or multivitamins just to round off where everything is. That's really where my focus is for most people. And then what we do is we test, then we treat, and then we retest. And in about 90 days, or about maybe 2, 3, or 4 months, after the body's able to make a significant metabolic shift, we want to retest those markers that we tested originally and find out, are we moving the needle? Are we
Um,
making improvements? Do we see a change going on? Again, it's all objective. It's not based on guesswork.
I love that about your clinic. Absolutely. What would you say to someone who um, says, I don't have the money for that? What would you tell someone who comes to you with that sort of statement?
Well, compared to what? Compared to, I mean, if you think that eating organic is expensive, try pricing cancer treatments. You
Yeah,
know,
absolutely.
this is not for people that frequently go to the dollar store and eat ramen noodles and everything like that. There's a time and a place to save
Mm,
a buck or two, but when
yeah.
it comes to your health, that is not the time to compromise what's going on. Now,
Mhm.
is this stuff affordable? Yes, it's very affordable, and there's financing opportunities available. Uh, we can give people very low monthly payments by going through a local lender and dropping the price really far down
Mm,
and spreading it out over time.
nice.
It could be done, but I want people to understand that the number one priority for them is not money. It's about their health. It's about
Yeah.
getting back what is missing. Because, honestly, if you're dead, you can't enjoy anything.
Absolutely. And by the time we start showing really significant symptoms, we're probably pretty far along in the disease process, right? Or the autoimmune system has been taxed for quite some time. like today at my chiropractic office, I was looking at some x-rays with a client, and he had bridging osteophytes, bone spurs, etc. And of course, his acute problem was that you know, it was like we've had a horrible winter and lots of snow blowing and shoveling. And I said, these bone spurs didn't come overnight. These bone spurs didn't happen this winter. These have been slowly growing through repetitive, injuries for decades. And it's really the same with our metabolic health, but we just can't see it as clearly, or it doesn't talk as loudly, perhaps.
Yeah. Yeah. People want you to fix 30 years of degeneration with one visit. They don't want to pay for it and they want it mail order.
Mhm. Yeah.
So we're all in the same exact boat. I have the same exact people that come to see me, and I show them the osteophyte activity, and I show them the hypolordosis, and I show them the degenerative disc disease that's taken 30 years to manifest.
Mhm.
And that is the first time for a lot of people that anybody has ever shown them their body. I mean, it's very medical doctors are notorious for not going over x-rays and MRIs and with people and showing them this is normal, this is you. Can you see that you have a problem? Can you see that there's something out there? I
Yeah.
just what I have this thing where I want people to own their problem. I want
Mm.
people to understand every aspect of the problem, how long it's been there, how it's affecting their life, how it's contributing to the symptoms that they have, and, I will take the time to explain that stuff to them in a very simple way, in a way that they can understand. And, a lot of them are just surprised, like, "I can't believe that you're doing this because nobody else has ever done this," and that's kind of the sad part.
It is sad. It is sad. A lot of people now have like a medical records portal, and a lot of this information is uploaded. And, this was the case today with my patient. They wonderfully had the disc so that I was able to pop that disc in, and we were able to look at that x-ray with our own eyes. And I said, the radiology report gave you this very basic information, but we're going to look at things a little deeper. We're going to look at the curves. And so, what I love about you looking at the root cause is that people do have to consider that this is not a band-aid. This is not just going to cover symptoms. This is like truly, like you said, looking at that deep root cause and addressing the deep root cause. And I like that you say, I don't know what the term was, but people have to own it, right? You
Yeah,
have to own your health. You have to not sort of like put a ticket at the door when you see the physician and say, I don't have any responsibility, right?
yeah.
We have to like say, yeah, gluten doesn't agree with me or dairy doesn't agree with me, and like take really, really solid measures to change that for themselves, especially once they find out all this information.
You know what, if it's a musculoskeletal problem, will reach into the chiropractic world, and they'll take care of it that way. If it's a metabolic problem, then I will reach into the functional medicine world. Like, you can't fix a thyroid issue or a blood sugar problem just by adjusting their neck. It's not gonna happen.
Right.
So,
Yes.
you have to have that cleared up right away. It's not about cracking their neck or their back and fixing a metabolic issue or a dietary problem or a nutritional deficiency. They have to understand that I can reach into both worlds
Mm,
and help them that way. I'm not gonna be able to fix a problem like lung cancer. So if the person has a severe problem like that, I will refer them out, whether it's to a psychiatrist or to an oncologist, cardiology or whatever, we all have a role to play. And
Mm-hmm.
my role is in the world of uh, chronic conditions. So
Doc, we're gonna have all of the links in all of my social media posts and at the end of the podcast itself in Apple Podcasts and Spotify and YouTube, etc. But do you want to tell our listeners who maybe they're driving right now how they can find you?
sure. So the easiest thing to do would be to visit my website at which is metabolicsolutions.net. Metabolicsolutions.net is my functional medicine page. And from there, you can take a free 2-minute health assessment, metabolic health assessment. And from there, you can find out if you have a problem, how severe is it? Is it mild, or moderate, or severe? And get results sent to you immediately. So just
Wow.
go to metabolicsolutions.net. And from there, you'll see a drop down for the free metabolic health assessment. And you can take that. It takes about 2 minutes of your time. It's not very long at all. And you answer a couple of quick questions, and then your results are sent to you via email immediately. So that's the best thing that you should do to find out what's going on. And if you have a problem, and if you want to communicate with me or ask me a question, just fill out the contact form on the website, and I will get back to you.
Wonderful. So you don't have to be in Pennsylvania in order to receive care from you, right, Dr. Smith?
That's correct. So, unlike physical therapy or chiropractic care, which is more of a hands-on type thing, as long as you have a phone or an internet connection, we can still communicate, and we can drop ship you labs. We can drop ship you supplements. I work with some online supplement stores like FullScript to be able to get you what you need, and then just figure out what the problem is so we can put an end to the suffering. So I work with people from Florida. I work with people from California, Idaho, Colorado, New Mexico. It doesn't matter where in the continental United States. Sometimes it gets a little bit tricky if you live in a country in Africa because of the time zone differences and customs and all that stuff. So I would prefer to work with people in the lower 48 states.
Okay, wonderful. Well, Dr. Kevin Smith, metabolicsolutions.net. And cheers to everybody really taking a closer look at their health and what might be a slow, autoimmune thing that's building. It sounds like you've developed an amazing 2-minute questionnaire that I'm hoping a lot of our listeners will check out.
Well, I think so too. Thank you very much.
Thank you for your time today.
Thank you for having me.
Thank you so much for listening. If you've enjoyed this podcast, would you please rate it, review it, like, or subscribe? You can find me on social media at wautierwellness.com, Dr. Stephanie Wautier on Instagram, or Wautier Wellness Chiropractic and Massage on Facebook. And I'm so curious where your next conversation will take you.
Hey there, it's Wayfair here, where delivery and setup are as easy as a few taps on your phone. You're relaxing in an old hammock, scrolling Wayfair's app, when you spot it, a brand new patio set. Next thing you know, Wayfair delivers it right to your patio and sets it up. Oh, you need a new grill too? All right, Wayfair's got you covered. With Wayfair's room of choice delivery and fast expert setup on qualifying orders, life gets a little easier. Visit wayfair.com or the Wayfair app.
Wayfair, every style, every home.